Namaskar and welcome to the 26th episode of Gyan Pravah, a podcast series, the brainchild of our super dynamic president, Dr. Sunita Tandulwadkar. I, Dr. Charulata Bapaye, chairperson of the Breast and Puerperal Health Committee of Fogsi, takes immense pride and pleasure in welcoming our dear Dr. Sunita Tandulwadkar and, of course, all our viewers to today's podcast. Madam, as I sit here today for this podcast, it is very overwhelming as to try to even start introducing you. Madam, you are the star. She believes in creating leaders, not followers. She believes in equal opportunities for all. She is an amazing sangam of pure intellect, hard work, and talent. Madam, I think that myself and probably all the chairpersons of Foxy are so blessed to, get hand holding, inclusivity, and so much guidance from you. Madam, you are a symbol of strength and knowledge, along with a miraculous touch of spirituality. I think that the organization is really moving ahead in leaps and bounds under your able leadership. Madam, both of us are from Pune. I have seen you. You've come from another city, settled down in Pune, and grown so big. And you, along with yourself, have taken Pune on the international map. So we are really, really blessed to have you as our president today. And over to you for a few words.
Hi, Charu. What a luck, yeah. We three are from the same city of Pune. And now I realize that we would have done a podcast physically also. We did not realize. But nevertheless, this digital world itself is a great thing. Charu, you are amazing working. Your breast health, I always used to think when this committee has started couple of years ago, ki what work these people will do and the way you are adding on to every aspect of it. You pursued that the puerperium also should be coming there because breast equal important part is a lactation, and then lactation means the puerperium should be covered. That is a really, the mark you are putting in the Foxy. So every committee chairperson should do some work which will bring the footprints on the map of Foxy, and you are doing it. And probably we are conceptualizing a very different project. I may say people still are not aware because the ideas have come. We are working on it from Kashmir to Kanyakumari for the breast health awareness program, what we are going with, and the Sampurna. That will be amazing yatra from Kashmir to Kanyakumari will be doing. And I'm very sure that with the amazing uh, capacity to work, Charu will take this yatra to another level. We might have started dreaming at one level, but when it will end in Kanyakumari, it will be another level. So in April first week, we'll be launching at Kanyakumari, and mid-August we are ending it at Kashmir, and in August we will be ending in Kanyakumari. That will be amazing footprints as a committee chairperson you are putting.
Thank you.
Today, your podcast is with Dr. Shekhar, and it was amazing to read your biodata. Of course, Charu will introduce you, sir, but the multi talented, multitasking work, what you do apart from just the medicine, was beautiful, heartening to read about it. And sometimes, since we are in Pune, let's have a coffee together and we will explore many more things. So I give it to Charu to have more about Dr. Shekhar, apart from his surgical skill, apart from his specialization, what else he does. And I'm sure today's podcast will explore many more things and we will learn a lot about you. Back to you,
Thank you.
Charu.
Thank you for those fantastic words, madam. And as I said, it is entirely your inspiration and your inputs, because as you rightly said, we just give one small draft and you expand it to such immense levels that it becomes something which is all inclusive. So, madam, thank you so
Dear,
much.
it is years of working in various organizations.
I
The
agree with
concept
you.
which you got in and the concept what we are going to make will be out of the box.
Absolutely, madam. So, today, welcome everybody to Healing Harmony, where we are going to deep dive into the stories behind science, health, and creativity. I take immense pleasure in introducing our guest for today, Dr. Shekhar Kulkarni.
Okay.
Imagine a life where the precision of a scalpel meets the creativity of cinema. Our guest today is not only a leading breast surgeon, but also a talented singer, actor, and film director. He's someone who has dedicated his career to saving lives while also touching hearts through his art. So, can you imagine somebody who did general surgery and then decided to concentrate only on breast surgery? He's trained at the Tata Memorial Hospital and also at Birmingham, UK. He's the managing director of the Women's Cancer Screening and Mammography Center of Pune. He's the founder of Astha, a breast cancer support group. He's the principal investigator of thermography for breast cancer screening. He's a proponent and student of Indian classical music therapy. He has conducted numerous programs of Healing Harmony, which is a musical show on lifestyle and cancer awareness. More than 200 shows, friends. And this is such immense work that he's doing. And hence, today's program is called Healing Harmony. He's conducted more than 200 breast cancer screening camps in urban and rural India. He has been a lead actor in various Marathi and Hindi films, Nital, Sanhita, Astu, and Samantar being a few. I had the proud privilege of, playing a minuscule role in Nital. I'm so happy to have associated with you, Dr. Shekhar. He has also made a film for us, Anand Yatri, for our very own breast committee of Foxy, along with Amrita Khanvilkar, a noted, film actress. I think it was a beautiful film. We'll play it sometime, madam. He's a writer, he's a poet, and he has amalgamated medical science and musical therapy for giving patients a better quality of life. So, as the chairperson of the Breast and Puerperal Health Committee, I thought, who better can I start my podcast series than with Dr. Shekhar Kulkarni? Dr. Kulkarni, welcome to our podcast series. And I'm sure we're going to have a great interaction about life, about cancer, and about life after cancer also.
Thank you, Charu. Thank you for a very kind introduction and warm words. Thank you.
Thank you, Shekharji. Thank you for being with you or in one frame with you. I never knew such an accomplished person exists in Pune. And definitely, apart from this podcast, I would like to sit with you sometimes, gupshup over a chai.
Yes, yes, I'll look forward to it eagerly.
Yeah, we will. Thank you. As we go, I'll leave this, and only two of you will have a dialogue with each other, and I'll listen to you from another link. Thank you. Thank you once
Thank you.
upon for
Thank you.
being on a Foxy platform.
Thank you
Welcome.
for having me here.
Thank you.
Thank you, madam. Thank you so much. So, Dr. Shekhar, as I go through your
Yeah,
bio,
Charu.
hello, I see that you've been trained to be a general surgeon. And then how did you move over to being a breast surgeon? I think it was an era when, like this kind of niche, uh, performances or niche surgeries were not the norm. Today you have only IVF specialists, only laparoscopic surgeons. But at that time, say 30 years back, we didn't have anything like this, where you were doing a niche practice. So what
Yeah.
motivated you to become a breast surgeon?
Charu, when I finished my general surgery training and I was doing my lecturer's post at Sassoon Hospital, I started exploring the outside world. I wanted to do my practice. And then I met few surgeons, senior surgeons, whom I found were very unhappy.
Mhm.
They had invested a lot in their practice about 25, 30 years, and they were not really fully living their lives. They were so engrossed in their practice that they had actually compromised on their own personal life, personal happiness, personal family, and everything. So I thought that if I trade on the same path, I'm going to end here unhappy. Not everyone, but unfortunately, I came across a few big surgeons who actually told me that, "अरे ये मजा नहीं आता है." So I said, "अरे ये if I continue doing this, then this life work balance will be complete mismatch." And I have so many hobbies as you described. These
Right.
are all my hobbies. I won't say accomplishments or anything, but I do it for my own enjoyment. Then I realized that if I do not pursue my own hobbies, nobody's going to tell me to do that. Nobody's going to tell me to be happy in my life. Finally, I want to achieve something that I really cherish. So I said that, but I wanted to sing, I wanted to do drama, I wanted to write poetry, I wanted to do so many things. But I was also a trained surgeon, so that was my first priority. I'll be doing my surgery, but at the same time, I need my time, my own time for my own inner upliftment, inner development, and my enjoyment, my family life. So I sat down one day and I thought, what kind of surgery will be good for me so that I won't have so many emergencies. I would be doing surgery. Uh, I would be, giving up surgery will be a bad thing after doing so much. And then I realized that breast surgery, as you said, that there was no breast surgery at that time, like no dedicated breast surgery faculty at that time. It was in 1996, 97. Till then, we had done 5, 6 years of post-surgical practice and jobs and all. So I said, breast has probably that kind of potential that it has. You can do public service like screenings, a huge topic. You can do surgeries, you can do chemotherapies, you can do plastic surgery, you can do rehabilitation things. So there was a huge spectrum of things that could be done in one faculty called breast surgery, although it was not here in India. But I said probably I can do that. And but there were no work. I mean, no big amount of work that time. So people ridiculed me. People laughed at me. They said, "Yadai, why are you doing all these things? Like there are no breast cancer surgeries, no one goes for plastic surgery. India is a poor country. These are all rich countries things. So you don't go for that." But I was convinced inside my heart that I'll probably do that. And so I started doing that.
And
And
lo and behold, that I
fortunately,
think, yes, you are such an accomplished surgeon today. You have a leading name in the city and outside also. So I think, pursue your dreams and follow your dreams is probably the message that, we could take from this inspiring part of yours.
yes, I'm saying this for the new surgeons who are starting their life, starting their practice, that pursuing your hobbies can be beneficial to your practice also. It
And
does not
yes,
actually compromise your practice, it actually enhances your practice. You get to see all aspects of your life. What happens, Charu, is that when we are trained as surgeons or trained at MBBS students, we are taught anatomy, physiology, biochemistry, medicine, surgery. But nobody at that tender age of say 18, 20, nobody teaches us logic, nobody teaches us philosophy, nobody teaches us literature. And these are the things which actually make your life meaningful. So if you remember, I had started one library in our art circle, BJ Medical College. There was no literature library, so I got donations from people and started that library. And we used to take 10 rupees a monthly contribution from everyone. And then I used to promote that. Read this, read literature, read this, so that you will become a good person, and that will make you a good doctor. So that
absolutely.
was the thing that was in my mind when I started doing a small niche surgery. And I was a lazy person also. I couldn't stand for 13 hours doing cardiac surgery and brain surgery. So that also was there.
So I think becoming a well-rounded personality is what you have become today, thanks to you pursuing your dreams. So I also want to ask you, Shekhar, is that we have all been in practice for close to 30 years now. And you have started describing how things were at that time. So what change do you see in the incidence or the presentation of breast cancer, which has today become such a significant disease? Once upon a time, we thought it was only a disease of the West, but today we see that it is the number one killer among women in India also, and it has overtaken cervical cancer and has reached the number one
Fortunately,
spot. So, what is the your experience regarding this journey over the last 30 years as far as breast cancer is concerned?
everything has changed. If you remember, we used to have a long question in our surgical or examinations, and we used to start from incidence, introduction, incidence, prevalence, etiology, presentation, and we used to make one paragraph. If I sit down today, I'll be writing entirely different thing in all these paragraphs. What was there in 1993 when I wrote my surgical papers, today it is entirely different. I remember, if there was a case of, say, 28 years old girl in my long case, suppose that time, and I if I in my differential diagnosis of lump in a breast, if I said breast cancer, they would have failed me that
So
time. Absolutely failed me on the spot. But today I am seeing so many girls with 28, 31, 35 also, and even younger, with breast cancer. The incidence has grown massively. Incidence and probably detection in India. Like,
yes,
you go 30 miles from Pune, and some tribal woman gets a breast cancer. The breast cancer grows, and maybe she dies of breast cancer. Nobody knows. Nobody realizes that it was a breast cancer that she died of, and so it doesn't come into your statistics also.
true.
And yeah, this kind of incidence that we are seeing today is and detection is growing. So unfortunately, as a business person, I should be saying that I'm happy that I'm getting more patients. But as a social person, I'm saying that it is a bad thing that we are getting so many breast cancer patients. So everything is changed. But one thing good has happened that has happened is that the mortality of breast cancer, even morbidity to some extent, has significantly reduced. That's because um, excellent treatments that we are having to these days, superb treatment. So we'll come to those points
Yeah, we come to
eventually in our
that.
discussion. But as to answer your question in brief, everything has changed, except for one thing, probably, that in India we are still getting advanced cases.
Uh-huh.
All over the world, we are getting mammography detected non-palpable breast cancers. But in India, even in Pune, in high class, upper stratum society people, we are getting women with big tumors, almost fungating tumors. That's one unfortunate thing that still remains in
Yes,
India
I
that
think
has not changed.
the fear of finding a lump, the fear of having to undergo the treatment modalities, that still exists in our minds. And as you rightly said, that in the West it is diagnosed so much earlier, as opposed to India, where it is occurring at a younger age group also, and it is being diagnosed later on also. And so, in spite of so many new, treatment modalities that we are probably finding it. No, difficult to significantly reduce the mortality because of this particular
True.
disease. So I
And
think,
expense.
and life expectancy, that is right,
No,
and
no,
the quality of
expense.
life, the
I'm
quality of,
saying expense. The
oh,
woman does not go to her husband and says that I have a lump, because she's afraid that who will pay for the whole thing now? Our budget is so tight. The children have their fees to be paid, and the household expenses, and there is no insurance. We still have no health insurance ecosystem in our society. So women are afraid, and they prioritize their health at the lowest of the list,
correct,
at the
correct.
low of the list. Yeah.
Absolutely rightly said. And so, when we think of a breast surgeon, we really wonder as to how does your OPD pan out? Like, how does your OPD look like? What are the usual common complaints that you find, and how do you tackle them? And how does your day look like? Because of your multi-talented, nature.
Of late, I have done one thing, that I've divided my day into two parts. Mornings till late afternoon, I do my medical practice, and in the evenings and night, I do my art, kind of other things,
Oh,
all
okay.
other things. So I try to balance almost 50-50. But having said that, my first priority is my patients. Even if I do, even if I'm shooting a film, and if there is a patient, I would give preference to my patient than to my shooting. So that's one thing. Secondly, as it's no brainer to say that all my patients are women. Although we say that breast cancer can occur in men, but that's very rare. That's not very common. Even being a breast surgeon, I get very few male breast cancers. So all are women. And so I'm surrounded by women all the time. Like, I mean, I have my wife and two daughters. Like, at home, all women. We had a puppy that was also female. So again, that was a woman. Then generally people have holidays on some big days. I have holidays on Mangala Gaur and Nag Panchami and such things. So, so my entire ecosystem
Yeah,
is
but
female
plenty of
centric.
that is
Yeah,
right. So I think
yeah.
the problems range from breast pain to maybe unequal sizes of breasts and to small lumps and small cysts. And I'm sure that breast cancer is just one part of your entire spectrum of patient load that you usually get. So, what is exciting you about what new developments in breast cancer management that you want to highlight or touch upon, which is really exciting to you and makes us feel that yes, we are reaching somewhere we can really help our patients well.
Okay. A sad part as far as the surgeon is concerned, that surgery, the proportion of surgery in this whole paraphernalia of breast cancer treatment is slowly getting down, reducing. Previously used to do radical surgeries, extra radical surgeries. Then slowly it came to modified radical surgery. Then it came down to breast cancer conservation surgery, where we used to do lumpectomy and axillary clearance. Nowadays, we are trying to avoid axillary clearance also as much as possible to avoid lymphedema and further complications. Neoadjuvant chemotherapy is now given not only in locally advanced breast cancers, but even operable breast cancers. So once you give neoadjuvant chemotherapy, the tumors reduce to such a small size, sometimes they completely go away. So the proportion of surgical intervention is getting less and less and less. But the
Good
kind
for the
of drugs
patient.
that we are
Yeah,
getting, yeah, it's good for patient, very good for patient, because it avoids mutilating surgeries like amputating your breast. That's such
absolutely.
a mental and physical trauma.
Oh yes.
So we are avoiding all that. But the drugs that are available nowadays are phenomenal, phenomenal. It looks like a miracle. I sometimes can't believe that this is happening. You know, so the drugs are wonderful. New drugs are coming every day. The drug toxicity is getting down. You can manage toxicities very well. So chemotherapy, radiotherapy has changed like drastically. I remember the days when radiotherapy patient used to come back after that cobalt 60 therapy with a burnt toast like chest. Nowadays, we don't even see a flake of pigmentation on the breast after completion of radiotherapy, which previously used to take 6 weeks and 5 weeks. Nowadays, they are completing in 5 days, 7 days, 10 days. Brilliant. So this technology has taken this breast care to a very different level now, and it's very good for patients. So the entire scenario has changed, and surgery is becoming less and less. And the robotic surgery is going to come and replace me, and it's going to give me a lot more time to do my films and all, so that I'm going to be out of work very soon.
I think with all our ERPR receptors, HER2 receptors, we kind of have some tailor-made kind of approach for each and every patient, is it not? So
Absolutely.
one shoe will not fit all, and you will have just specific treatment to each and every patient. And as you rightly said, that it is so much less morbid that the breast, which is an organ of femininity, for the woman to have the breast removed was so much of mental trauma. And today, thanks to your oncoplastic, techniques which you're using, I think saving the breast is one of the best things you're doing for the ladies' mind and body. And we see that the results are probably just the same, if not better, with even oncoplastic surgical techniques because of so many newer modalities that are available
True,
today.
true, true.
And so
Yeah.
I think you're really doing a great job for your patients and helping their mind as well as body. And
Yeah,
now,
it's not only ER, PR, and HER2 new, but now, Charu, we can actually find out the genetic signature of that particular cancer. We can do a somatic genetic study, a hereditary genetic, I mean, a germline study, and then we can actually find out what is wrong with that particular patient, what mutation is that an actionable mutation? Can we do a precision? So it's absolutely precision medicine. So no excessive toxicity for like carpet bombing.
Ah,
No carpet bombing nowadays, no excessive mortality, morbidity, but very precision and miraculous surgery with genetic molecular signature, genetic signature, proteomics. It's wonderful. It's wonderful. I wish we had that all in our undergraduate studies. We could have studied it better. Now I have to study it by going to conferences and reading.
yes, indeed, absolutely. So now that we've talked a little bit about the what do you see a professional aspect per se, let us come to healing harmony, which
Yeah.
is the name of our podcast for today. And what exactly are your healing harmony programs? How did you think of it? How did you start it? And we just really would like to hear about it.
When I came back from Tata, there were no patients. I was newcomer. I was trying to promote myself, going here and there, but there was a lot of time. So I decided that I'll start giving lectures to groups of Lions Club, Rotary Club, kitty parties, and all. So I used to go to various clubs and try to talk to them, but the result was not very satisfactory. Once I went to a group of PMT workers, the bus workers, and I gave them a lecture for about 1.5 hours about breast surgery, breast cancer, everything, awareness, early detection, everything. And then after 1.5 hours, after I mean, becoming breathless and perspiring and really working hard to give a good lecture to them. And I asked them, give if there are any questions, please ask. So the first question was that when are you going to make temporary workers permanent? Was the first question after 1.5 hours of breast cancer lecture. Then I said, no, 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 ask me something about health. So they said, okay, health. Then they asked me, why is that only women are made to wash the buses?
Oh my
Why
God.
can't male workers wash? So it was a complete disaster. Even after talking to them, so I said that it is not actually conveying what I want
Not
to say to the
working. It's
people.
not working.
Yeah. So, and I'm a singer, so I said let's make a program where I can talk also and I can sing also, and maybe if they don't get anything out of that in way of say information, at least they'll enjoy the songs. So I designed one program and I labeled it Healing Harmony because I wanted to talk about health. And fortunately, I got a few patients, breast cancer patients, who were brilliant, who are rather brilliant singers. So I got them. I made a team, and now the program, played out in such a way that they used to talk about their own experiences, and they sang, and they answered the questions of people, and I used to support them in the whole process. So it was so effective when people, the audience, looks at the woman who has had surgery, who had undergone chemotherapy, radiotherapy, and still she's there, vibrantly singing on the stage, beautifully clothed and made up and super. So they started becoming their icons, their idols, that these role models, that even after cancer you can live a wonderful life. So cancer does not necessarily mean death, was the message that was given without any words. It was seen on the stage, that their courage, their fighting spirit, their singing, their enjoying life, the whole thing was showcased in that program, and it developed into a beautiful musical program with narration. And so we started getting many invitations in India,
You have gone on mute by mistake, I think.
yeah, yeah, no, 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 sorry, I'm so sorry. Yeah, in my just
That's
okay.
right.
So we have now done more than 250 shows uh,
Wow.
everywhere. So that was the Healing Harmony. And then I am a student of Indian classical music. And then I realized in few patients that Indian classical music, given in certain ways, can actually help healing, can actually, yeah. So that was my first impression when I experimented it on a few patients, and then I realized that music has a very uh, uh, it's a powerful tool. If
Yes.
used properly, it's very powerful. So I started experimenting on music therapy for my breast cancer patients, my post chemotherapy patients, and I found good results. So I've started doing scientific works also. So it's a kind of healing harmony. It was
Fantastic.
initially, yeah, yeah. Go on, please.
So inspiring for all the audience also, I'm sure, and that helped you to touch the lives of so many people, and encourage them to come forth even if they had any problem, and probably they got treatment in time thanks to these healing harmony
Yes,
programs. And it was indeed a
yes.
pleasure, for me also to attend one of these programs, and it is beyond fantastic. And I would also like to thank you on this platform, because you have designed this kind of a program for our Foxy also, when Dr. Alpesh Gandhi sir was the president of Foxy, and we did this beautiful program in the month of October, where all your people, cancer
Yes,
patients sang. We had it in our house, and
yes,
we
yes. That
filmed the whole
was
thing, and it
so
was
much fun.
all because that time it was the era of COVID, so it was through a webinar that we had
Yes,
conveyed all these things through the conference platform. So Shekhar, you have always been such a great support to not only to me and to so many other people as well. So I take this opportunity to really thank you for all this that you are
it was
doing.
my pleasure.
Help all of us. So I think you have always managed to take your hobbies and your interests for the well-being of mankind, for the well-being of the society, for the well-being of your patients. So one more activity that you have started, which probably was non-existent at that time, was a cancer support group, Astha. I think even your the name that is seen
Yeah,
just
yeah.
now is Astha itself. So you and Astha are inseparable, looks like. So can we know a little more about Astha?
Okay. When I started my practice, I realized after looking at the lives of my post-operative and post-treatment patients that initially when the cancer occurs, when there is a diagnosis of cancer, the women find the first support, the initial support in their doctors. They say, "No, we have our doctor. He is our God. He will do everything, and he will heal us, and he'll cure us, and everything." Right? And that's to some extent is right on their part. Slowly, slowly, they start realizing in due course that this doctor does not have enough time for us. He's so busy in doing so many things. He has so many patients. So we cannot actually completely rely on him for our psychological, physical needs. So they start looking at other support groups, supports in their lives because it's a very vulnerable situation. You're looking at death. You don't know what will happen. It's all dark in front of you. And so you need some support, some help. So, fortunately, we live in India. We have a very strong family support system. So, the second support system after the doctor is their family. They rely on their family for everything, and family also supports them. Even distant relatives come to the help, come to their places, do so all sorts of things. But even and breast cancer especially has a very long good survival, long prognosis. So slowly months pass, years pass, and this family also start. I mean, they have their own lives. The children have their colleges, husband has the job, and everyone has their own lives to live. So slowly, the patient realize that they can't even take have their support because they have their own lives. It's a family lives. Then the only support that remains is a self support. They need to support themselves. Now it's a very difficult thing. You are not trained in doing that because you're always getting support from somewhere else. So I realized that if you want to have your own support, you develop own support system, you need to form an ecosystem that will actually be conducive to such an idea of supporting yourself. So I said that creating a group of similar patients can probably help. So I thought it was a comradeship in distress, a
Wow.
person who is in distress. Yeah. So it was a comradeship in distress. When I actually put that together, the people came together, all breast cancer patients, and they started sharing their feelings. They're sharing their concerns, they're sharing their problems, they're sharing their emotions. And the sharing meetings became so powerful, so potent that they led to emotional catharsis, unburdening of emotional problems.
Mhm.
And that actually led to a very strong support system, their own. They started helping themselves. with the help of others. So while they got help from others, they helped others. So
Wow.
it was a support system for everyone, and then it developed. It developed into a very good society of breast cancer patients. And then, as you say, but unfortunately, the dynamics of any cancer support group is very bad. In other groups, we have, the group goes on, but here people die. So
Yes.
I mean, it's not like any other group, any other kitty party or a Rotary Club or a Lions Club or anything. It's a different thing. So they started to learn how to cope up with death also.
Oh, 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 oh.
Yeah, so they developed a philosophy how to look at this thing, how to look at life, how to look at death, and so that whole group matured into a very good philosophical entity. And now this group is now, till that time, it was looking inside for their own support. But slowly, slowly, once they got their inner support, they started looking outside and started helping the society, like going out, creating awareness, helping them do screening, helping early diagnosis, sometimes helping patients financially also, poor patients,
Wow.
are organizing lectures from experts. If you go to a plastic surgeon or a chemotherapist, an oncologist, he'll give you 5 minutes, 10 minutes. So you won't be able to ask all your doubts and all your problems to him. But if that person comes to your group and gives a lecture for 1.5 hours, and you ask him questions, and he gives you the solutions and replies, that becomes a very good source of knowledge also, one to one, face to face. So this whole thing developed, and so that this was Astha Breast Cancer Support Group. There is no formal membership. You don't have to pay anything to be a part of that. You just be there, come there. It's like a river. Anyone comes there, drinks and goes back.
Oh,
Sometimes sits on the bank of the river, enjoys life and goes back. So
well,
and yeah.
very well said, genuinely. And so now moving over to, the films.
Oh,
You are an actor also. And so, how did films happen? Did your surgical career play any kind of different role, when you went into acting? And did being a doctor help you in acting, or does acting help you in your surgery? How does it go?
well, first thing I must say that I'm a very lucky person. Lucky to have friends like you, lucky to have good people around me, lucky to have good mentors. So I was simply very lucky. So once I had gone to some place and was sitting there with Anil outside, and Sumitra Bhave and Sunil Suptankar were shooting something inside, and they came out, they had packed up and they were going home. Suddenly Sumitra Bhave looked at me and said that, you are a doctor. Hence, Anil outside introduced me to her. She said, "You are a doctor, okay, but would you like to act in a film?" I said, "Why not? Who will say no to such a question?" I'm anyway. I was into dramatics in our BJ Medical College, and
Yes, of
we used
course.
to do all sorts of things. So I said yes. So and then that episode ended there. Like, I mean, nothing happened. After a few months, I got a call from their office that we are making in a in a process of making a film. And would you like to act in our film? Because we met at Anil Avsad's place, and would you like to act in our film? It's a role of a doctor. So I said, role of a doctor. In any film, the role of a doctor is a very minuscule and a very poor role. That I know that either he drapes the whole, I mean, put a chadar on the head and say that हम इनको बचा नहीं सके, या when then the doctor says that तू इनके बच्चे की माँ बनने वाली हो, or something like that. So I was not very enthusiastic about that role. That is, somebody is offering me a doctor's role, but they insisted that you come. I avoided. I know I'm busy. I'm busy. But then once they called me that you come to our office and let's have a chat. So I went there. They said that, are you interested, really interested in doing a film? I said, yes, I am. I am. So they said, we will offer you a role, but if you pass the audition and the screen test. I said, yeah, I'll come back for the audition and screen test. No, no, no. They said, no, no, no. You have to do it now. I
Oh,
said, my God, now. So, okay, I said, okay, go on. So they brought a camera, they gave me a script, and they said, this now do something, read this and act or do whatever. So I took that script and I read, like I used to do it on the dramatics. So once that happened, they said, okay, go home. We will not promise you anything, but we'll let you know. So, and after 4 days, I got a call from them that we are offering you the role of a hero in our film, the lead role, and
Fantastic.
will you be able to do that? Will you be able to, in the sense, will you find some time in your surgical practice? I said, whatever, I'll reschedule it in such a way that I'll absolutely do it. I jumped onto that opportunity, and then that first film happened. I had not even seen a camera, but I was in a lead role, and you also were there in that film, in that
And
cameo.
that was such a beautiful film about vitiligo.
Yeah.
And, it gave such a beautiful message without, over bombarding with medical terminology or something like that. And it was beautiful. It was really
Yeah,
fantastic.
yes, I learned from that film that you don't have to give information through the film. Information is everywhere. If you
Right.
have a mobile, information is there. You have to give the emotions. You
Yes.
have to strike the right emotions to give the feeling of whatever you want to convey to them. If you strike that chord properly, the whole thing happens. So I learned from that, and then I was involved in many films which were for medical awareness. So this was, like you said, vitiligo. Then I acted in a film. It's a beautiful film on thalassemia. Then
Uh-huh.
there was a beautiful film on eye donation. Then there is a beautiful film on organ donation, in which I acted with Nasiruddin Shah, and you must have seen that film. Yeah.
Yes. The
So
child becomes brain dead, and that one? No.
uh, yes. Right. Ratna Pathak and
Yes.
Nasiruddin Shah. That was a Fir Zindagi. And
Yes.
then I acted in a film of HIV also. So I learned that this film per se, is a very impactful and powerful medium to
Yes.
reach public, to reach the society, and you can actually convey what you want to convey to the society in a very effective way. So I enjoyed my films, and all these films, mostly few of the films are pure stories, but even it's a story, it has some social message in that. There's nothing like pure story. There is some message, some principle that a director wants to convey to the audience, even if it is an historical film, or some suspense film. So films is a very pleasurable activity to act also and to watch also. So
Absolutely.
and that it all obviously helped my practice also, because patients saw me in films, and film shooting is such a thing in society, that if somebody is working, like selling vegetables or doing something, nobody stops there and watches that. But if somebody is shooting, like it's a work like any other work. If somebody is shooting, people will stand there. People will stand there for hours together to watch the film being shot. Although it's an extremely boring thing to watch a film being shot, but people do that. So there's a huge glamour attached to a film. So that glamour, when it's attached to you also, can
Yes.
help your personality, and you go and meet very big people, artistic, creative people, and that influences your own persona. Probably that must have helped my practice also.
100%. And so, Shekhar, now comes the question as to which role do you really like the best? Whether to be being the breast surgeon, the actor, the singer, the director, or, what do you find most fulfilling, per
Breast
se?
surgery. Breast
Ah,
surgery. This is
okay.
not a political answer. No, not. Absolutely not. Yeah,
Hmm.
it is a very fulfilling. Once you're a surgeon, you cannot live without blood. You know that. You
Ah,
have to work.
you have to
You
have blood
have to
on
work.
the hand. Yes, yes,
I
yes.
know you have to work, and that's a very satisfying thing. We can see that whether it is breast surgery, or whether it is art, or whether it is singing, it is ultimately for making the world beautiful.
Right. Right.
Whether you do breast surgery, you're making something beautiful.
Well
You're
said.
saving somebody's life, removing something bad, stitching up something which is torn. So you're making it better.
Yes.
Similarly, when you're doing something in your art, you're singing, you're doing some film, you're doing something to make the world better.
Wow.
So it's anyway, both go in a same on the same principle line. But and if you ask about what I like most in our acting, or music, or this thing, is the direction.
Uh-huh.
Yeah, director is a god. He
Oh,
can create the world like it's Brahma. When
wow.
there is nothing, I know, when there is nothing, you can create the characters, you can create the story, and you can present it to the people. When there was nothing, you create something out of it. So being a director is a very fulfilling, at the same time very challenging role. I
Sounds
like that most.
that. So, Dr. Shekhar, I'm going to torment you with a few rapid fire questions before we wind up. And so, surgery or singing in front of 500 people, which is more nerve-wracking for you? Does anything give you stress?
So singing,
Does it? Uh-huh.
very,
Oh.
very. mm. Because if if there is something goes slightly wrong in surgery, you can pause, you can give pressure, you can, unless you commit a blunder, but you can actually go and rectify the thing.
Uh-huh.
But if you become besur in while singing on a stage, it's gone. It's
Oh,
completely gone. So it's a very nerve-wracking thing. Singing in front
okay.
of 500 people.
If you could direct a biopic on any historical figure, what would it be?
Richard Feynman.
Sorry?
Richard Feynman.
I.
He was a physicist and he was brilliant physicist. He was a Nobel Prize winner. He was a
Uh-huh.
musician, and he was such a brilliant thing. And I am always fascinated by intelligent people. And he was very intelligent, and he was artistic also. And he had so many qualities, and he was so humorous that if somebody asks me who I look at as an idol, or I want to make a biopic, it would be Richard Feynman.
Oh, wow, I need to go back and read about this person now.
Yeah, yeah, absolutely. He's wonderful.
Can I make one small request to you, Dr. Shekhar? You
Yeah.
know, all of us would really like to hear your mesmerizing voice. Uh, do you think you could just,
Now,
yes,
okay, but the quality of the sound will not be good because I'm used to.
I understand. I understand. But just before we say a final goodbye, any favorite song of yours which you would like to hum? Because even before the program started, you were humming a little bit. I
Yeah,
heard
and
that
you asked me to stop the mic.
because there were
Yeah.
other things going on.
Okay. I'll try to say a few lines. I do not know whether it will sound properly on
It
this
will,
sound
it will,
system.
Dr. Shekhar. We know you are a fantastic singer. You have rocked the Mahatma Gandhi Auditorium of BJ Medical College, and you have always been our star performer. So we
That
would,
was long back.
oh, but you are still today.
Can you hear this?
Absolutely. No, we can't hear the music. We can't hear the music.
Can't hear the music?
No, I can't hear the music.
Let me try it again.
Okay.
Can you hear this?
No, I can't. I think to
No?
me, no, even if you just hum a few lines, we will be happy.
Okay. जवानी आए मस्त मस्त बिन पिए जलाए चल रही है राह में दिए न जाने इनमें किसके वास्ते हूँ मैं न जाने इनमें कौन है मेरे लिए मेरे लिए मेरे लिए
Thank
okay.
you so much. Thank you so much for that. And I think that it has been a fantastic talk, a fantastic interaction, Shekhar. Although I know you for 30 years, today was an even more bigger eye opener. I came to know so many other things about you. And I really feel very proud to say that you are a good friend. And I really would wish you all the love, luck, health, and happiness to continue doing all that you're doing for your patients, for society. And we look forward to seeing many musical videos, many new films, and many movies in which you will be acting. So I really take this opportunity to thank you sincerely for being
Thank
with
you.
us on this podcast of
Thank you,
Gyan
Charu.
Pravah.
Thank you so much. And thank you, Dr. Tandulwadkar, for giving me this opportunity. We'll be in touch and do something good in future together.
Absolutely.
Thank you.
Absolutely. Thank you. Thank
Thank
you
you.
so much. Thank
Thank
you.
you.